Sleep paralysis. Trapped between worlds. Sleep paralysis is a frightening but relatively common phenomenon experienced by many people at some point in their lives. It's characterized by the inability to move or speak while falling asleep, hypnagogic sleep paralysis, or waking up, hypnopompic sleep paralysis. While terrifying, it's generally harmless and temporary, though understanding its causes and coping mechanisms can significantly reduce anxiety surrounding the experience. What happens during sleep paralysis? Sleep paralysis occurs during the transition between sleep stages. Our brains cycle through different sleep stages, including REM, rapid eye movement sleep, where dreaming occurs. During REM sleep, the brain sends signals to temporarily paralyze the body's voluntary muscles, preventing us from acting out our dreams. Sleep paralysis happens when this paralysis persists even after we've woken up or while we're falling asleep. The mind becomes conscious, but the body remains immobile, creating a feeling of being trapped. This disconnect between the mind and body can be incredibly unsettling. Many individuals report experiencing vivid hallucinations, both visual and auditory, during an episode. These hallucinations can range from benign to terrifying, often contributing to the overall feeling of dread and helplessness. Common hallucinations include feeling a presence in the room, seeing shadowy figures, or hearing whispers or noises. Causes of sleep paralysis. While the exact cause isn't fully understood, several factors are known to increase the risk of sleep paralysis. Sleep deprivation. Lack of sufficient sleep significantly increases the likelihood of experiencing sleep paralysis. Irregular sleep schedule. Inconsistent sleep patterns disrupt the natural sleep-wake cycle, making the body more susceptible to sleep disturbances. Stress and anxiety. High levels of stress and anxiety can trigger sleep paralysis episodes. Underlying sleep disorders. Conditions like narcolepsy, insomnia, and other sleep disorders often co-occur with sleep paralysis. Genetics. A family history of sleep paralysis may increase an individual's risk. Substance use. Certain medications and substances, such as stimulants and alcohol, can disrupt sleep and increase the risk of sleep paralysis. Coping with sleep paralysis. While sleep paralysis itself is not harmful, the fear and anxiety it generates can be significant. Here are some strategies to manage and reduce the frequency of episodes. Improve sleep hygiene. Establish a regular sleep schedule, create a relaxing bedtime routine, and ensure a comfortable sleep environment. Manage stress and anxiety. Practice relaxation techniques such as meditation, deep breathing exercises, or yoga to reduce stress levels. Address underlying sleep disorders. If you suspect an underlying sleep disorder, consult a doctor or sleep specialist for diagnosis and treatment. Cognitive behavioral therapy, CBT. CBT can be effective in addressing the anxiety and fear associated with sleep paralysis. Recognize the experience. Understanding that sleep paralysis is a temporary and harmless phenomenon can help reduce fear and anxiety during an episode. Try to remind yourself that it will pass. When to seek medical attention. While most cases of sleep paralysis are benign, it's important to consult a doctor if episodes are frequent and disruptive to your daily life. You experience excessive daytime sleepiness. You have other symptoms suggesting an underlying sleep disorder. Sleep paralysis, while frightening, is a manageable condition. By understanding its causes and implementing effective coping strategies, individuals can significantly reduce the frequency and impact of these episodes and improve their overall sleep quality.